Hi everyone. We usually wait for a couple of people to jump on here and start watching. So I am here with CosMediTour's exclusive surgeon, Dr. Michael Geraghty. So Dr. Michael Geraghty actually specializes in breast surgery. So we did a live Q&A last year about breast augmentation. So tonight, Dr. Geraghty is going to be answering questions about breast augmentation with a lift. So we're going to be talking about scarring concerns, fat grafting or fat transfers, and also how you can get a free quote with Dr. Geraghty. But first, we'll have Dr. Geraghty talk a little bit about himself because Dr. Geraghty, you've been performing surgery for 15 years now. Is that right?
Bella knows how much I like talking about myself as well, so I'm going to talk for a while. 15 years. So I finished medical school in 2004, which seems like a while ago, and then I started my surgical training in Ireland, and that went on for 2 years in total. And then I continued that journey here in Australia. And along that journey as well, there was some time doing American exams and the UK and Irish exams as well. And blink, and there, before you know it, 16 years is just gone.
Perfect. And you also have an honours degree in medicine and gynecology, is that right?
This is true. So I graduated from the esteemed institution that is Trinity College Dublin in Ireland. And as part of that university degree, we do both medicine, surgery, and some obstetrics and gynecology as part of the training. And then we also get a thing called a BA, which is a Bachelor of Arts as well. And then you continue along on your surgical journey. Well, I did anyway, and I achieved the qualification to be a member of the Royal College of Surgeons in the UK and Ireland, and that gives you this thing called MRCSI, and that's one of the titles that you'll see behind my name.
Perfect. And you're probably at this stage performed on over about 400 CosMediTour clients alone.
Yeah.
Perfect.
So the majority of those cases are breast focused, with a combination between breast augmentation and breast augmentation with a lift, otherwise known as a bilateral breast augmentation mastopexy. So I suppose we believe in the philosophy of when you do something, you do a lot of it, and at that point then the more you do of it, the more expert you become, so to speak.
Mm-hmm. Okay, so we'll get into the questions now. Probably the most commonly asked question at CosMediTour regarding a breast augmentation lift is that I have been recommended a breast lift with an augmentation, but can I just have the augmentation? So just the implant alone. What do you say to that?
Yes, you can. Yes, you can. Look, what it comes down to is expectation management. So what I deem to be beautiful versus what Bella deems to be beautiful versus what Sam Hughes deems to be beautiful, who just joined us there on Instagram, is very, very different. However, what we do know is there are some common threads, and the common threads that run through this are where will my nipple be sitting? Okay. Now, in the aesthetically pleasing breast, okay, so when you look at all those little sculptures around the place, one will see that the nipple is sitting on the apex of the breast mound. And in those patients where the nipple is sitting quite low, if you don't elect to do a procedure to lift the nipple up, some people would deem that to be aesthetically mispleasing. Now that's some people. And part of the job of the surgeon or the doctor is to counsel the patient about that. And as part of that counseling, we would show you photos and go, this is a patient who did have a lift, and this is a patient who did not have a lift, and this is the position of their nipple as such. And if a patient is so inclined that they're happy with the nipple sitting low, by all means you can continue and do that. That's not an issue at all. And I think it's very, very important to recognize that, coming back to that point about what's aesthetically pleasing for me versus what's aesthetically pleasing for a patient can be very, very different. But it's my job to try and manage or match the patient expectations. And that's why when we do the consultations, we like patients either A, to come with a photo, or B, to have a very clear idea in their head what their desired result is. And that can help us achieve that desired result.
Mm-hmm. And a lot of women who have quite a lot of breast ptosis or sagging often think that if they just get a really large implant to fill up the skin, what do you say to that? Same sort of thing.
That's a really good question. And it's funny because I personally had a patient like that recently, and that works temporarily. And that may work for 4 weeks, it may work for 6 weeks, it won't work for 6 months, okay? So as the breast swelling settles down, what one can notice is that gland ptosis, or that loose tissue, breast tissue at the bottom of the breast, starts to hang off the implant. And again, that comes back to what does one deem to be aesthetically pleasing? Now, say to my eye, I may go, well, that's not aesthetically pleasing, but the patient may say, oh, I may be comfortable with that. It's also important to recognize that in some instances, one can have a second bite of the cherry. So it may come back to the surgeon to say, yes, you could consider doing an implant alone, recognizing that your risk of requiring a lift in the future is very, very high, i.e. higher than 50%. I would caution or counsel against using an implant that's too high profile to try and fill up the breast pocket as such, because that can place too much strain on the skin. And as a result of that, then you get a lot of stretch marks on the skin, and it can be a position that's very difficult to rescue as such.
Mm-hmm. So basically, as long as someone will recognise and accept that their chance or risk of revision surgery in future, which can tend to be quite expensive and complex, is pretty high. 100%.
100%. And this, again, this comes back down to education and understanding. And as a surgeon or a doctor, when you're sitting in front of a patient, it's not only my job to counsel the patient, but you're also there as an educator, okay? Because it's unreasonable for me to expect that a patient has as much knowledge as me, okay? Because this comes back to whatever the 16 years of doing surgery as such, and the 5 years of medical school. So you've got nearly 20 years there where you're trying to learn knowledge. And it's unfair to assume a patient would have the same knowledge as one with the background that I have.
Mm-hmm. Perfect. Okay, so another common question is about the brand of implants that you use.
Now, that's a very good question. Here, for the most part, we use the Motiva implants, and funnily enough, I actually took one out. Now, the reason we choose the Motiva implants is multifold. In the first instance, it's a safety profile. So the over 10-year data just came out from Motiva, our establishment labs about their breast implant, and during that time they've a very good safety record. Now inevitably the question comes back to the ALCL, or that rare form of blood cancer that's associated with breast implants, and to date there's been no reported cases with the Motiva implants. Now we're basing a lot of our decisions among the safety profile of the implant, because this the safety profile of the implant is time dependent. So the longer this implant is in the body, you want it to be safe, to be safe, to be safe. We don't want the safety profile to go down, down, down as time passes. Okay? So we want it to stay safe for the duration of its lifetime.
And I should probably mention that through CosMediTour with Dr. Geraghty, Motiva implants are at no additional fee, which is pretty common with some other companies because it's quite a premium brand of implants. So another common one is about recovery after a breast augmentation with a lift and possibly not being able to breastfeed. So can clients still breastfeed after this surgery?
Yes, they can. Yes, they can. Now, this is a very good question. This is a very good question because we are seeing an increased number of patients who are still of childbearing age, who may choose to have kids in the future, who are having the breast augmentation with the lift. And that comes back down to counseling the patient. Now, one of the things that we choose to do is the pocket placement. So almost invariably, we choose to place the implant, the breast implant, behind the muscle, and that increases the likelihood of future breastfeeding. Okay. Now, I sometimes say to my patient, if I could give a guarantee for 100% about something, I would be living on an island somewhere that I own and probably not operating. Now, I wish I could guarantee to patients that you will be 100% able to breastfeed after a breast lift and implant, but I cannot say that. Because anytime one does an operation on an organ, there's a risk that that organ does not function the way it did in the past. Now that organ could be a kidney, it could be a liver, it could be a breast. All right, and it's important to recognize that. And again, this comes back down to us being the educator and the counselor and saying to the patient that yes, there is a risk to your breastfeeding apparatus. Yes, we will do everything in our power to minimize risk of damage to the breastfeeding apparatus for you in the future.
And it's probably worth mentioning that some women maybe can't breastfeed irrespective of the surgery.
100%. 100%.
Okay. Probably top 3 most common questions as well is about scarring. So it might be something that will hold you back from having this surgery. So people may really want to go ahead but are really concerned about the scarring. So what can you say about that?
I would say I'm relieved when I hear that somebody is concerned about scarring, because I'm concerned about scarring too. And that then means that we're on the same page. And part of this comes down to us taking a detailed history from you and also taking a scar history. So we're assessing your body to see, okay, do you have other scars in your body? How have you scarred in the past? Right? What type of skin do you have? Because that can help us kind of risk profile you for your future scarring. You know, are you at risk of a keloid scar? Are you at risk of a hypertrophic scar? One of the things that we choose to do in terms of our implant choice is not choosing an implant that's too big. So again, one of the things I'll say to the patients is talking about skin tension. So it's a fine line between having too much tension and not enough tension. Okay? So if one does not have enough tension, it means that the breast may toes again in the future. And we're always talking about longevity of the result, so we want a result that lasts a long period of time. But if we have too much tension, then we're predisposing you to such things as poor wound healing and poor scarring. And this comes back down to the experience, okay? And doing a high volume of cases. And doing a high volume of cases means it increases your experience, increases your knowledge. And it's also been shown to improve your outcomes or the surgeon's outcomes as such.
Okay, perfect. So we've just had Stephanie Jane ask, how long will I be off work after surgery as a heavy machine operator?
Okay, this is a good question, Stephanie, and I'm so relieved that you put in that you're a heavy machine operator. The reason we advise patients about the time off work or modified work duties is we want to optimize your result. So in terms of an operation, there's before the operation, there's during the operation, and there's after the operation. And the operation itself is a small part of the journey. Before the operation, it's talking to us beforehand So we have an idea of what your desired result is. During the operation comes down to us, and after the operation comes down to you. So let's say, for example, I do an operation that I deem to be amazing, okay, and I deliver you back and I say, here is this amazing result, over to you. Now there are certain things that one can do to affect the result. So let's say, for example, you're a heavy machine operator, and after 1 week you go back to work. That's going to impact your result, because if you're lifting heavy items, because of where we've placed the muscles, so let's say we place this breast implant and we've lifted up your pec and we've placed the breast implant here. If you're lifting heavy things, the impact of that is to push the breast implant down and out. And often I'll say to patients, our aim is to try and achieve braless cleavage. Okay, that golden thing that the majority of people want is braless cleavage, where they can go out without wearing a bra and they have amazing cleavage. But if you have activated your pec major muscles too early, that has the impact of pushing the implant down and out and creating a gap. And I can tell you for sure that you won't be getting braless cleavage. Okay, because you need to wear a bra to keep the breast implants where they are. And trying to achieve that braless cleavage is technically very, very challenging. And the thing about it is, Bella, if you're going to invest all this time and money in having the operation, you want to get it right the first time. Okay, you don't want to be going back there and doing pocket revisions for surgeons. Okay, because that in and of itself is painful for both the surgeon and also for the patient, because you've invested time initially to have the first operation, and you don't want to be investing time later down the track to have that revision operation for a lateral displacement of the pocket where the breast implant is falling out to the side.
Mm-hmm. And I suppose most people do recover differently, but can you give a rough time frame on when, clients might be able to go back to the gym or drive or lift their children or do, those general things?
Okay, so good question. I would break it down break your body down. So let's say you have upper body and lower body. So really you'd be able to go back to the gym, I say, to do fixed pin exercises with your lower body after 2 weeks, just light weights. In terms of your upper body, all right, you're going to be wearing the bra all the time for at least 6 weeks. Then once that 6 weeks has passed, okay, and you're getting closer to the 8-week mark, at that point in time, you can start going back to the gym, just lifting light weights. But again, you'll need to be wearing your supportive bra at all times.
And how long is that, the full 6 weeks in the bra?
I've started to recommend the full 6 weeks, and even in some instances closer to the 8 weeks. And you might say, well, why is that? Well, because each patient is different. Okay, each client is different. Each chest wall is different. Each breast is different. And I know it's very, very challenging for our support staff, because we'll be sending in our post-operative instructions and our staff will be following up the patients, and it's like, okay, well, this patient is going to be in a bra for 6 weeks and this patient is in a bra for 8 weeks. But again, this comes back down to the client or the patient-centered focus. Okay, so you were treated as an individual.
Now, with the breast augmentation and lift surgery, because there is existing volume, is it possible to get a faker, more obvious round outcome?
Yes. And a line that I'm sure my patients are very bored of hearing is, the number one predictor of your end result is your starting point. Number one predictor of your end result is the starting point. How do I mean? Well, let's say your starting breast looks very, very natural. Okay, it looks very natural. So you have a lot of breast tissue that's sitting in the lower pole of the breast or the bottom of the breast. If that is the case, all right, there are certain things that we can try and do to overcome that natural look that you have. And one of those things that we can do is our choice of implant. So in that instance, we'll be suggesting to patients, well, let's use the round Pro Gel implant, and that's the implant with the slightly firmer gel, for example. Okay, so when the implant goes in, it tries to fill up the upper pole because most of your breast tissue is down the bottom. Okay, the other thing to say is, again, on a case-by-case basis, case by case. So if a patient comes in and they say, I want to look round and fake. In some instances, that may take 2 operations to get there. Okay, again, case by case, because one does not want to be in the position where you're putting in a very large implant and you're compromising your end result just because you're putting in a breast implant that's large. And generally that doesn't stand the test of time. And I come back to this point about getting a result that lasts a long time. All right. Now, of course, there are instances, or patients, or clients, where they have a very low BMI, or they have a complete deficit of breast tissue. So they're just skin only. In that instance, okay, again, the number one predictor of your end result is your starting point. In that instance where there's an absence of breast tissue, to achieve a round look is relatively easy compared to that patient that has a lot of breast tissue that tends to camouflage the implant.
And would you say, just going back to the implant shape, so the round or the teardrop or ergonomic in the Motiva, is it as simple as a round gives you a faker look and a teardrop is a natural look?
I wish I was a politician because I want to give a politician's answer. Yes and no. What I will say is, and again I'm going to say it for the 4th time, the number one predictor of your end result is your starting point. There is this misconception that if you use a round implant, you will look fake. That's not the case. I'm going to do something that's very controversial, and don't worry, I'm going to wash this implant, Dr. Geraghty. So what you want to imagine is I've put this breast implant underneath thin skin so you can see the outline of the breast implant a lot. So if you're a patient that is just skin only, okay, and you insert that breast implant, you're getting a round look. But if you're a patient and you have a lot of breast tissue, like this coat, it camouflages the breast implant, so you cannot see it. So if a patient comes to me and they've a lot of breast tissue, more than 2.5 centimeters, and they say, I want to be round and fake, I will say, this is very, very challenging to do because your body, okay, is determining that your breast implant gets camouflaged.
That makes sense. Okay, perfect. So we also get a lot of questions about fat grafting or fat transfers, which I believe you would refer to as a hybrid breast augmentation when you use the implant along with the fat.
Yes.
Do you offer that? And also, do you offer the fat instead of the implant?
So if you read the textbooks and you read the journals, yes, you can. The thing about it is what the fat graft can do is it's good as an adjunct, as a supplement to an implant, for example. So if you have got very subtle cleavage lines that you want to augment, or you have a hint of a double bubble that one wants to eradicate, in that instance, one can use fat. I think one has to be very careful where you're trying to do an augmentation with fat alone, okay? Because the volume of fat that's needed to do that can be quite high, all right? And the other unknown that one is dealing with is the fat graft take, all right? Now there are various numbers out there, Okay, so some people would say 40%, some people say 50%, and some people would say 70 to 80%. Now, one thing in life is for sure, wherever you see such a variability of percentages, okay, and that applies to everything, it means that no one is certain, okay? So what it comes back down to is this word, reliability and safety profile, okay? So is it reliable and is it safe? Okay, so if you've got a fat graft take that varies anywhere from 40 to 80%, one would have to question the reliability of that, particularly where you're doing large volume of fat grafting.
Mm-hmm. And so your body, can it metabolize the fat post-surgery?
Let's just say that the fat doesn't take as such, so you've injected, let's say for example, 100 cc's, okay? And anywhere from 50 cc's to, maybe 30 cc's may actually be resorbed by the body or dissolve away. So that comes back down to the reliability of the procedure. So can I look you in the face and say, oh, we've put in 100 cc's and 100 cc's is going to take? No, I can't look at you in good conscience and say that. And this comes back down to the reliability, okay? So again, it's one of those procedures where one can put in 100 cc's of fat and in 3 months' time you've noticed that your breast shape is the same as before the procedure, and that can be disappointing.
Mm-hmm. Okay, and we've just had Leah Sims ask if anyone can get fat grafting.
Anyone is a bit like always, or never say never. So there are always relative contraindications to fat grafting. Some of those relative contraindications could be in someone who has a very low BMI, therefore they don't have any fat to harvest. And also, perhaps somebody is on certain medications, that means the fat graft take will be quite low, or there's a risk of them bleeding after the procedure. And all those things are relative contraindications, but it's something to be borne in mind when you're making the decision about fat grafting. But again, that's on a case-to-case basis. By all means, we would be happy if you sent us an email regarding your specific case. All right, and we would try and answer or address your questions as best as possible.
We've also just had Holly ask, with the breast augmentation lift, is it always under the muscle, and is it always a round implant?
We generally choose to put the implant behind the muscle, and there are 3 reasons for that. The number 1 is the longevity of the result. Number 2 is it tends to preserve blood supply to the nipple, which is very important in this instance. And the 3rd reason is it tends to preserve the sensory function to the nipple as well. And 4th reason, we mentioned a little bit earlier on, is increasing the risk of you being able to breastfeed in the future.
Okay, and just quickly going back to the fat grafting, can you harvest the fat from an area of the patient's choice?
Yes, we can. We can. There are a couple of sites that we like to use. The reason being is, we want to camouflage our donor sites as such. And one has to be very careful again that, we're borrowing from Peter to pay Paul as such. Okay. Now we don't want to borrow from Peter and leave him with a deficit as such. And what you can notice sometimes in people who've had liposuction is they end up with these things called contour deficits. And the other thing to consider is you're giving somebody a little scar in another region. Okay, so these are all the factors that we have to address on a case-by-case basis. Specific donor sites that we look at and that we like the medial thigh. Okay, we like the medial thigh because we can camouflage a very small 1 to 1.5 millimeter stab incision in the groin crease. We tend to find the fat in that region is relatively bloodless, and we tend to find when we harvest from that region we don't leave any contour abnormality. What we want to imagine for you as the patient is that in 6 months' time, okay, when it's summer, you will be able to go on the beach and wear a swimsuit without any of the sequelae of a fat graft harvest on your body. And if I can't guarantee that to you, I'm not doing my job.
And so we've also had Georgia ask about the areola size and if that's able to be reduced in this surgery.
Yes, this is a good question because it's not uncommon post kids that the diameter of your nipple areolar complex widens. Okay, so it can go anywhere greater than 5 centimeters. Now, when we do the procedure, we reduce down the diameter of your areola to approximately 3.8 centimeters to be exact, or less than 4 centimeters. And the reason for that is it just tends to give you a better finessed result as such. Now, the thing to caution and watch out for is with time that can stretch a little bit, okay? And the other thing to watch out for is scarring in that region, and that's why we're fanatical about this scar management after 4 weeks to try and give you the best possible scar.
And we've just had someone ask about having surgery at 17 with parental consent.
On a case-by-case basis. And I think it's important in that situation, okay, as a patient advocate, first and foremost, patient advocate, okay, and that ability to advocate for your patient and advocate for your parent. And in those instances, we would be seeking the advice of a child psychologist or a child psychiatrist in the instance to make sure that we're all on the same page.
Okay, perfect. So, although you are located in Sydney and perform surgery in Sydney, a lot of people ask about